Hi everyone, my name is Laureen Corasanti and I am a rehab manager at the Visiting Nurses Association of Western New York. Today we're going to be talking about the stroke rehab program at home. Every survivor is different and recovery takes time. The Visiting Nurses of Western New York is able to help patients transition from an inpatient setting to a home setting with outpatient services when needed. We coordinate an interprofessional team with a range of disciplines based on each patient's needs. At the VNA, we have 11 certified stroke therapists to address the range of patients' needs, including physical, functional, cognition, and social issues facing patients. Here at Kaleida Health and the VNA, we can provide that continuum from acute care to rehab to home care to outpatient. Most recovery takes place within the first year, so it is vital that patients get the immediate care they need after a stroke. We have 11 certified rehab therapists at the Visiting Nurses, and we can address and tailor your treatments to the patient's specific needs and goals. Our services consist of physical therapy, occupational therapy, speech therapy, social work, dietitian, and nursing. We can tailor that program, again, to the patient's specific needs. Individualized plans of care. Treatment is tailored to your specific need and goals, depending on the extent to which you have been impacted by your stroke. We can help you restore function, the ability to perform activities of daily living, gain strength and endurance. We can also provide caregiver and family training to assist with medical techniques and devices. We can improve balance and mobility, overcome speech or communication deficits, address any swallowing issues or nutritional concerns, develop new cognition, communication, and behavior strategies. We can improve or compensate for visional deficits and provide adaptive and durable medical equipment for home safety. Our goal is to get you to return to work, school, or community activities as with much confidence and independence as possible. A study done by Martin et al. In 2002 looked at stroke survivors. Stroke survivors reported 6 months following a stroke that they felt abandoned by the healthcare system. They also reported poor access to psychological support, a lack of confidence in returning to social activities, and a fear of having another stroke. So, social support. Patients who have a better support system tend to be able to return to their home versus going to rehab. So, a better support equals better outcomes. So it's very important to have that social support at home following a stroke. So the presence and size of the social support network, as well as the perceived effectiveness of the social support network, have a positive influence on the physical recovery and quality of stroke post-stroke. Higher levels of support are associated with greater functional gains, less depression, and improved mood and social interaction. The size and perceived effectiveness of that social support networks are important predictors of the discharge destination. Again, better social support at home equals a better outcome. So what can therapists do? So stroke support caregivers report that bringing home a stroke patient is like bringing home a baby. There is no manual when you get home. So few receive adequate information about topics they perceive to be important. Caregivers rarely receive adequate training in the skills they require for the care. So here at the VNA, we try to ask patients what is most important to their recovery. We want to know what your goals are, and we want to meet those goals in the home.
Hello, my name is Geoff Stoltman. I'm a nursing manager at the Visiting Nurses Association of Western New York, and today I want to discuss the post-stroke care of our home care patients when they discharge home from the hospital and we are there to see them. We start with a comprehensive assessment of the patient by performing a thorough in-home assessment of the patient's needs, including physical, cognitive, and emotional aspects. We evaluate their mobility and communication abilities, as they may have a deficit post-stroke that needs to be assessed. Medication education is also an essential component of what we educate patients in home. We teach patients and caregivers about the prescribed medications that they take. We reinforce when they are to take their medications. We also explain the possible side effects of their medications. The important thing to explain is the impact this medication may have in reducing their risk of future stroke. Psychological support is also provided to our patients. We are observing for signs of emotional distress or anxiety in our patients and our caregivers when our patients are discharged home. We provide emotional support and coping strategies and will link with emotional and mental health support in the community as needed moving forward. Continuing on with the role of a home care nurse, we also want to help the patient adapt to life post-stroke. It may be quite different than the life they had prior to. We want to assess how well the patients and caregivers are adjusting to life after the stroke, with multiple visits in the home to evaluate their progress. We are going to identify difficulties related to how the new disability and patient's ability to merge what might be their new disability with a daily routine moving forward. We're going to offer solutions and community resources to enhance the caregiver ability. Home care nurses will continue to educate the patient and caregivers on the prevention of future stroke and reinforce the importance of physician follow-up appointments. It also focuses on rapid stroke identification using the acronym BFAST, B standing for balance, E standing for eyes, F for facial drooping, A for arms, S for speech, and T for time. Because when it comes down to it, the most important thing, if a patient might be concerned they're having a symptom of another stroke, it's to seek emergency care as soon as possible at the Gates Vascular Institute. We're fortunate at Kaleida to have a stroke survivors group, hosted on the third Wednesday of every month from 5 to 6 in the Swift Auditorium at Buffalo General Medical Center. We would like any stroke survivors or caregivers to join this compassionate community of people who are adjusting to life post-stroke. It is a journey. It is not always easy, but we at Kaleida want to stand with our patients and support them in the ongoing journey that is life after a stroke. Thank you for joining us for HealthyU. We hope to see you next time.